why charity? And I realize that some of this is provided by religious organizations, which some people just can't get beyond. Why hasn't there been, and I know the answer to this, it's kind of a rhetorical question, but tort reform, Good Samaritan laws would seem fundamental to lowering the cost of health care in this nation. If there was ever a case of break glass emergency response, those two things would be no-brainers, right?
Oh, absolutely. And we have certainly seen some good reforms in the charity care area. And once again, this goes back to vested interests that don't want competition. And but the bottom line is that when it comes to charity care, there is absolutely, it's absolutely shameful that anyone would oppose the people who are medically qualified to provide a service to do it for free and to help out. And even if one of the big issues is someone may not be licensed in that particular state, but they are licensed in the state in which they live. But whenever you take a look at disaster relief, it is absolutely reprehensible that you would have organized healthcare trying to stop people to come into your state after a tornado, after a flood, because they're not licensed in that state. That's absolutely ridiculous and it's shameful. And fortunately, we are seeing reforms in that area. That should not be the case. And I think exposing these instances when that happens really does help move the ball in that particular area.
That happens? Are you kidding me? There's an emergency, there's people who are injured, and medical people are barred from entering the state to help on an emergency basis? That really happens?
Yeah, I mean, that was really the impetus for Missouri changing their charity care law. That is exactly what happened.
Oh my God, that's horrible.
After devastating tornadoes, you had parts of the established medical, medical establishment not wanting physicians and other healthcare providers who are licensed in their own state. They're in good standing. I mean, you can have some rules like that where you want someone to be in good standing in their own state, but to come in and temporarily provide free care to citizens who are in dire need is absolutely shameful.
Absolutely.
Well, now let's jump ahead. You talk about the telemedicine and the impact of the internet, well, Skyping, remote access, things like that, particularly with regard to rural areas. You're advocating for broadening the scope of availability of that, aren't you?
Yes, absolutely. And so, of course, states should be, should want to make sure that physicians who are providing services to people in their state are in good standing in their own state. But there's absolutely no reason in the world why a state's policy should have requirements that go above and beyond what you're providing your own, what you would require, physically within the state. And furthermore, we do know that there is a lot of value. We know that people do still get medical care in person when needed. I mean, just because you have a telemedicine consultation does not mean you're not going to go to the ER if they tell you to go to the ER. And so this idea and fear that you would have telemedicine operating is really just unfounded. We know from decades of experience now that telemedicine is not only extremely valuable to not only the diffusion of information, but also to rural areas, particularly in emergency situations, particularly when an individual is not going to be able to travel a great distance to get another consultation, or quite simply, you have a working mom who suspects that her child has an ear infection, and it's very, she will lose, half a day of income if she has to take off of work to go. I mean, this really is a 2017 low-cost, affordable, improving access kind of solution that we really all should be embracing. And we do know now that, we are seeing a lot of movement in the private sector where a lot of employer plans are now offering telemedicine as a benefit, because everybody wins. The employer wins because the individual doesn't have to take off of work, assuming that they can go back to work very quickly after they get checked out to do telemedicine. But they don't lose income. People don't put off that, don't put it off, because a lot of times you can't get a same day appointment. So there are just so many ways that it's beneficial to be able to hail a physician either through your laptop or through your smartphone and pay $40 and get the care that get the care or advice that you need very quickly.
Direct primary care, that's a novel concept. I'm not quite understanding that.
So direct primary care is a little bit, it's a little bit different. It's a little bit like a gym membership where you have a doctor or a group of doctors that that are serving their members who pay a monthly fee. And in some cases they may get, a certain number of visits per month, certain services, or they may get unlimited visits. I mean, you can structure it however you want. The issue that we've had in states is that some states want to regulate this like health insurance, but it's not health insurance. It's like a gym membership. And so what we've done is we have helped support basically laws that just keep it legal. We've corralled this off from insurance regulators. We want them to keep their hands off of this because this is not insurance. We want it to just be another option for individuals seeking care. And that is another area that's a win-win. Physicians don't have the overhead and the administrative costs that you have in a regular practice where you're dealing with insurance denials mostly in a lot of cases, unfortunately. And people can get in quickly. They can reach their doctor very quickly. A lot of the doctors will provide their phone numbers, their cell phone numbers, so that their patients can reach them 24/7. And then we also know that because these direct primary care facilities have very good relationships with labs and places that offer MRIs, for example, that we've seen cases where a person might go to the ER and have a $20,000 bill. They go to their direct primary care provider and it's under $2,000. And so we really, this is another option that should be legal. There shouldn't be government standing in the way or trying to regulate it out of business. And especially now that there's such a shortage of general practitioners. Part of the reason there's a shortage is because of all the hassle involved in dealing with all of the administration and all the insurance. This takes up the middleman. They're caring directly for their patients, doing the kind of work that they want to do. That is the whole reason they got into medicine. They didn't get into medicine to push paper. They got into medicine to care for patients, and this allows them to do that.
Now, early on, I think this was often referred to as a concierge medical practice. How much do you think this has been tainted by folks engaging in a little bit of class warfare on this? The perception early on being that it was available only to the wealthy.
Well, so concierge medicine is a little bit different. That's kind of a niche market. Direct primary care is something that employers are actually, enrolling all their employees into. I mean, this is really like a gym and a gym membership. And so, I think that those objections to it are, of course, not only misguided and wrong, but they're actually dissolving because direct primary care does serve people. And we now are looking at direct primary care as a model to be integrated into state employee health plans and into Medicaid. And so this is not some elite type of healthcare service. This is affordable. In many cases, people pay $60 a month. I mean, think about your co-pays. I mean, would you be willing to pay $60 a month for quick, efficient access to a healthcare provider who you actually know? And you can get in a lot of times the same day. The next day, you can call them on their cell phones. You can reach them. You can talk to somebody. This really is a no-brainer solution for a lot of people, for a lot of physicians, and for a lot of healthcare consumers. This is, we know that there's a lot of opposition to new, novel, innovative ideas in healthcare. We see it all the time. But this is one, where the genie is out of the bottle. They're not going to be able to stop this one. This is good for everyone involved in the healthcare system, and especially when you see employers who do provide health insurance for their employees doing this on top of that benefit. I mean, this is something that where everybody wins.
And I guess the point of tonight's discussion, we don't, in order to advocate for any one of these reforms, and you've got about a half a dozen great ones here, we really don't need to have some sort of cathartic national moment, do we? I mean, these are steps that, again, the analogy I use is break glass, add water, instant relief, pop, pop, fizz, fizz. Are these too straightforward? Why aren't these happening at a faster pace?
They are happening. I mean, change comes very slow. I mean, in a lot of cases, you'll have to have a couple of states adopt the policy, and then others will, learn from that experience. They'll jump on board, and so we are seeing a lot of positive changes. And quite frankly, I think there is so much frustration on the state level from state lawmakers, from state capitals, about the state of healthcare and what Washington has done to the insurance markets in the states. They've taken control of the individual market away from states. They have have created a giant mess that, states are now scrambling to clean up Washington's mess, and Washington is stalled. So there's a lot of appetite at the state level to continue to push these reforms. They know that they don't need to wait on Washington, or they're learning that very quickly. They don't need to wait on Washington. They can do these reforms now, today, to really impact access and affordability. And I think that there's also broad recognition that even if you were to completely repeal and replace the ACA, you'd still have a lot of problems in the healthcare system. I mean, the ACA was, never going to fix them. The problems that were in existence before. But states not only have the authority, I think that now they do have the political momentum to move forward in a lot of these areas.
I'm probably the oldest in the whole crew here. I remember it wasn't that long ago, and this is, you could answer this question probably in 2 or 3 hours, but if there's any way to encapsulate it, it wasn't that long ago that people paid a reasonable annual fee. It's something that corporations could support without crushing their bottom line in an attempt to keep the very best employees. Healthcare was something that was affordable to all. If there was, I don't know if there's a way to snapshot and answer this, but exactly what went wrong? How did we get here?
That's a good question.
So we basically have a third-party payment system in this country where there is an insurer that's gotten in between the patient and the physician. This happened in World War II during when there was a wage freeze. As an alternative to the wage, to get around the wage freeze, basically employers started offering these healthcare benefits. And this is the fundamental, the problem in our healthcare system is that you've got a third party paying first dollar coverage. We've got to get back to portable health insurance where the individual is price sensitive, they have an incentive to shop, they know, where you're actually able to buy truly catastrophic coverage. You don't have to buy a health insurance policy that pays for every routine healthcare visit.
Right.
You can have a policy that where the individual can shop around, they can look for the best deals, they can have a lower premium in exchange for a higher deductible. I mean, it really is common sense. And by doing so, what we've seen over time is that insurers and other third-party payers have really continued to drive down the reimbursements that physicians receive. Physicians don't have the capacity to offer the charity care that they used to because they're getting such low reimbursements in many cases. And so, we really have to go back to the drawing board. Change in healthcare is going to be slow. It is hard, but it is absolutely worth it. And I think as every day that we go by under the federal government's control of the healthcare system, under the Affordable Care Act rules and edicts, I think the more we will see people demanding change at the state level.
Can I say something? Yeah, I want to, absolutely, I want to echo that, and I want to point out that the effect of this oppressive government regulation and all of these mandates has been that so many of us now have Potemkin health insurance coverage. We pay a very high premium, we have very high deductibles. I couldn't afford to get sick. I pay a high premium, but if I need something, I can't afford the deductible to get that procedure. So I effectively don't have health insurance. And that is the case with millions of people around the country. And that has been isn't that right, Naomi? That's been the effect of this oppressive, heavy mandate hand.
It absolutely is. I mean, there are so many families around the country that are paying $20,000 between premiums and deductibles. They don't have a network in their local area. They don't have access to the nation's top hospitals because those hospitals are not participating in these plans anymore because of low reimbursements. I mean, it really is. It's a national disgrace that there is an actual requirement, a legal requirement, that they purchase something that they can't actually use.
Right, and and like so many other areas of government involvement, college tuition, as government injects money into the system, people selling college tuition or selling healthcare are able to drive their prices even higher because of the subsidies that are meant to save us money. We keep priming the pump, and it keeps blowing the price upwards.
Absolutely. I mean, so I think one of the good things that's happening in healthcare is that there is more transparency that's been driven largely by large employers who want more transparency, and so they've been demanding that and they've been pushing for that. And now, and if you can find the price of, not all providers will do this, but in many cases, if you're paying cash and you're paying up front, you can pay, like say 30-40% of what the hospital rack rate is for a procedure. Obviously you can't do that if you're rolling into the ER, but if you're gonna have a knee replacement, you can shop around. Employers have now have services, large employers have services where they will actually work with a small specialty hospitals that specialize in very certain specific procedures, where they will fly an individual and a companion across the country, get the surgery, get the service, put them up in a nice hotel for a couple days. They fly home, and they often do this at a quarter of the cost of what it would cost at their local hospital. This is already happening.
We both know someone who had some major shoulder surgery this week, and I won't say who, but who ended up, I guess, going down to North Carolina from the Providence market. And this is the sad part. I mean, we are blessed here in the Rhode Island, Boston Beltway, if you will, of having arguably some of the finest hospitals in the world.
Yes.
But they're all under this immense financial stress because of all these ebbs and flows that you've alluded to this evening. We're, to me, the real risk is not only financial, but we're at risk of destroying, if you will, arguably one of the finest healthcare systems in the world, all because of this overarching government process. Naomi, we've just met tonight really for the first time, but I got to ask you the general question, and consider this political t-ball. Are you aware of anything that the federal government's gotten involved in that's made it better?
Off the top of my head, I really can't think of anything. I mean, I really, particularly in the economic area, there really aren't any shining examples as far as I can recall. This is the idea that you would have bureaucrats or lawmakers in Washington trying to decide or trying to impose a one-size-fits-all system on everybody is absolutely crazy. You would never want, lawmakers to determine what should be in your monthly food plan, what you should be buying at the grocery store. Why would you want them determining what you should be required to buy under healthcare? It doesn't make any sense. And the more, unfortunately, the Affordable Care Act should be a cautionary tale for every area of federal involvement. There are, obviously some limited ways in which there are, some legitimate functions of the federal government, but healthcare shouldn't be one of them. And we've seen the very tragic results of what has happened to many individuals who not only lost their insurer, they lost their doctor, no one saw the $2,500 reduction in average premiums for a family of four. If anyone claims that they did, it's because it's being subsidized by our taxpayer dollars. But the Affordable Care Act has failed on every promise that was made. The idea that we would want more of this is absolutely frightening, that anyone would want more of this. Now, I realize that that people do need health care. We should have a vibrant safety net, but that doesn't mean that you upend 1/6 of the nation's economy to achieve that. There are a lot of different ways and avenues that you can actually provide a safety net. And we're actually, unfortunately, we're actually destroying the Medicaid safety net as we speak through the Medicaid expansion. What happened was that in order to entice states to expand Medicaid, the federal government was offering $9, basically $9 or $10 in federal spending for the original Medicaid population. You were getting about $1 from state spending. You would get $1 of taxpayer funds. So there's a very perverse incentive now. If a state is facing a budget crisis and they need to cut something, they're going to look first to the Medicaid, the most vulnerable population, not the expansion population, where they're drawing down $9 for every dollar the state spends, where you've got able-bodied adults above the poverty line who don't need the full range of benefits that is required under the federal Medicaid law. They certainly don't necessarily need the same type of health insurance package, but that's what's required. But you've got waiting lists of developmentally disabled individuals around the country waiting for services. They're under that that dollar for dollar match. I mean, it's roughly dollar for dollar depending on the state. But meanwhile, you've handed out millions of Medicaid cards to able-bodied adults above the poverty line, and you have made the waiting lists for care for the most vulnerable longer. You've made it more difficult for them to get appointments. It was already difficult for them to get appointments with specialists. You've made that worse, and now the financial incentive for people working on budgets at the state level is to cut those services, to limit those. The ACA is doing to the safety net. There's a lot of disagreement about, Medicaid and, what should be done, but don't we all agree that that is absolutely perverse?
Oh, absolutely.
My God, yes.
Folks, if you're just joining us, in fact, you are listening to the Coalition on the Worldwide Coalition Radio Network. Joining us live via Skype is Naomi Lopez Bauman. Of course, she is the Director of Healthcare Policy for the Goldwater Institute, goldwaterinstitute.org. This segment, of course, is brought to you by the fine folks at Beacon Shipping and Logistics. You'll find links all over our Facebook page and our website. Libertarians, small government friends nationwide, should you be listening now live or hear this via our YouTube channel, Beacon Shipping and Logistics provide automobile transportation nationwide and worldwide to liberty lovers everywhere, whether you be a proud member of the Libertarian Party of the state of Washington or you be here locally back here in Little Rhodey. Of course, iServices LLC providing internet data management services across the internet spectrum here in Portsmouth, Rhode Island, supporting the entire state of Rhode Island into Connecticut. Again, as we said earlier, with our other sponsor, Air Science.